But today, we are very honored to have with us a cancer specialist, Professor Mikkael Sekeres, with us to talk about how to prevent and fight cancer scientifically. That's the key word. Well, welcome to CGTN, Professor Sekeres. Nice talking to you.
Thank you so much. What a privilege it is to be here.
How about we start our conversation by the very definition of cancer? Many people find the idea of cancer very scary because we don't know very much about it. It feels very mysterious, very complicated, especially when many types of cancers are incurable. So what exactly is cancer in simple terms? Why do some of our healthy cells turn against us all of a sudden and go rogue?
It's a terrific question, and thank you for asking it. Cancer, at a very basic level, is the uncontrolled growth of cells. Across our lifetime, our cells grow when we start as a baby and then become adults. Of course, that's the most obvious example. We get bigger because our cells grow. But as adults, our cells also grow and replace themselves. And that's a normal process of cell aging, death, and rebirth. But when cells grow and grow and grow in an uncontrolled fashion and ignore the normal body signals to stop growing, that's the definition of cancer. If that happens, for example, in the breast, a woman gets a lump because those cells are outgrowing other cells around them. If it happens in the lungs, a person gets a mass, again, because those cells are outgrowing other cells around them. And if it happens in the bone marrow, as occurs with leukemia, the bone marrow fills up with these rogue cells.
Right. With the concept being given, Professor, the bad news is that cancer is on the rise globally. I read from IARC reports that by 2050, we would see over 35 million new cancer cases each year, almost doubling the number in 2022. What do you think is driving the surge?
Yeah, another great question. And I think there are a number of factors leading to the increased rates of cancer diagnoses worldwide. First of all, people are exposed to a lot of different things in their environment. That could be the environment as we're walking down the street and we're talking about things like pollution. It could be things we're exposed to in our diets. So as people in healthier nations get bigger, there's more of an obesity epidemic, for example, in more developed nations. That's also a risk factor for things like cancer. It could be environmental exposures like smoking or drinking alcohol, or the increased rates can also be related to how we define cancer. As we're making diagnoses earlier and earlier, and our definitions of cancer have expanded, we're increasing the rates of cancer simply because we're diagnosing more things that we're calling cancer, and we're diagnosing it at earlier stages.
So you mean the enhancement of technology can also serve as a factor of more diagnosis of cancer?
That's exactly right. So if you think about the last time you went to your doctor, if you go with a specific complaint, often your doctor will send lab tests, or your doctor will send you for an X-ray or a CAT scan. The more lab tests we send on people and the more X-rays and CAT scans we send people to undergo, the more likely we're going to diagnose a cancer at an earlier stage, and the more likely we are to diagnose cancers that we're never going to shorten a person's life, but we're detecting them earlier and at earlier stages.
Right, and we are also seeing a more worrying trend in the world that more young people are being diagnosed with cancer. For example, the rate of colon cancer, thyroid cancer, even leukemia are on the rise among young people in their 20s, 30s, or even 40s. And one analysis from Nature news feature predicts a further 30% jump in cancer cases among adults under 50 years old by the year 2030. Why do you think that is happening?
That's the million-dollar question. We don't know yet, but absolutely there are certain cancers where the incidence rate seems to be growing in younger adults, which is very concerning. Colorectal cancer, I think, has been the most notorious in this respect, and people have speculated that it may be related to increased rates of obesity in younger adults. Certainly in the United States, it's a terrific epidemic of obesity in younger adults. It may be some of the things we're exposed to also. It may be that we're eating more processed foods. People have even started to wonder if microplastics could be a cause.
Mm-hmm. But the factors that you mentioned just now are about lifestyle. You've mentioned before that roughly 40% of cancer cases could be prevented through better health or healthier lifestyle. So what do you think are the most crucial factors in terms of people's lifestyle in preventing cancer?
Well, the absolute top thing that people can do to help prevent the development of cancer, something that is what we refer to as modifiable, something that we can change in our behavior, is to not smoke. And if people do smoke, to stop smoking. The bad news is that smoking is related to a dozen different types of cancers, and it's unequivocally related to cancers such as lung cancer, head and neck cancer, and bladder cancer. Those are the biggies related to smoking. But it can also be related to other cancers you don't think about. One of those is breast cancer. Another is leukemia. So the first step is to not even start smoking. But there are a lot of people who have started smoking and are addicted to nicotine. The best thing that those folks can do is to stop smoking. And studies have shown that when people stop smoking for 10, 15, 20 years, their rates of developing cancer go down to the levels of people who never started smoking at all. So the good news is if you do smoke, you can actually stop now, and it will make a difference in your likelihood of developing cancer. Other lifestyle factors we should be focusing on: obesity is a big risk factor for a variety of cancers, including breast cancer and colon cancer. And exercise. It turns out that exercising prevents a number of cancers, lowers the risk of those cancers. And even if people get cancer, if they exercise, it turns out they have better survival than people who don't exercise after a cancer diagnosis.
Right, healthier lifestyle. That's something I need to think about right now. Well,
we all do.
Exactly. Yes. Well, now, Professor, if you had to give to the public 3 evidence-based, everyday life recommendations to prevent cancer or to at least lower the risk of cancer, what would they be?
Great question, reducing it to something people can remember. Number 1, don't smoke. And if you do smoke, stop smoking. Number 2, limit your intake of alcohol. So it turns out that the more alcohol we drink in the course of a week, month, year, the higher our risk of developing certain types of cancers. But reducing that amount of alcohol intake to no more than 1 drink per day, ideally less than that, lowers the risk of cancer. Number 3, avoiding highly processed foods, and if possible, avoiding or limiting the intake of red meat and processed meats.
Great. Now about fighting cancer, because we've been talking about preventing cancer or lowering the risk of cancer. Now fighting cancer. Cancer treatment has made a lot of advancements in these years indeed. It used to mean surgery, radiation or chemotherapy, associating with a lot of harsh side effects indeed. But now we have targeted therapies, immunotherapy, and CAR T-cell therapy, etc., etc. So would you please explain in simple terms the revolution of cancer treatment?
Absolutely. We started with cancer treatment. The earliest cancer treatments actually was surgery. If you can remove the cancer in its entirety, people live longer. Now, that is still the treatment of choice for certain solid tumors. For example, my own mom developed lung cancer. She was a lifelong smoker. Despite my efforts, even as a child when I was in school, to try to get her to stop smoking, she couldn't. She was addicted to nicotine. When she was diagnosed with lung cancer at the age of 74, it was confined to one area of her lung and it could be surgically removed. She's still alive 8 years later. She was lucky. She had an early stage cancer. So surgery is still a great method of treating and often curing cancer. Chemotherapy works and radiation therapy works by killing the cancer cells. Cells, you may recall from school, have a central nucleus, and in it you have genetic material, DNA. And that DNA, that genetic material, has to make a copy of itself for the cell to grow and make a copy of itself. Chemotherapy stops that process of copying the DNA, the genetics of that cell, and kills the cell. It works preferentially in people who have cancer because cancer cells are growing and dividing all the time. You have to have a growing and dividing cell for chemotherapy to work its way into that cell and stop it from growing and dividing. Same with radiation therapy. The revolution we have seen, particularly in the past 2 decades, has been identifying the biology, the genetics of those cancer cells, and then developing drugs that focus just on those genetics and disrupt how the cell works. And one of the most notorious examples is chronic myeloid leukemia. The first drug that truly targeted a cancer, the drug imatinib, was approved over 20 years ago in the US for treatment of chronic myeloid leukemia. Now, patients with that leukemia who respond to that drug, who do well with that drug, have a survival that's the same survival as somebody who never had a leukemia diagnosis at all. And we're using targeted therapies more and more in a variety of cancers. And for the first time, we're seeing people with lung cancer, like my own mother, who are living years afterwards because of those targeted therapies. The other breakthrough, as you've mentioned, has been immunotherapy. In other words, taking hold of the immune system and using it to fight the cancer. When our bodies develop those rogue cells that you mentioned earlier, those cancer cells that grow and divide, it's our immune system's job to recognize that they're abnormal cells and pluck them out of our body and get rid of them so cancer doesn't develop. So you can think of cancer development almost as a deficiency of the immune system. So we now give drugs that use the immune system to fight those cancer cells and get rid of them. And in CAR T cell therapy, which you mentioned a little bit earlier, we're actually removing cancer cells from a person's body, deliberately growing an immune system to attack those cancer cells and reinfusing it into the person with that new army that fights just those specific cancer cells.
Those are great news indeed, Professor. But still, people tend to follow some easier ways, such as superfoods. These days, indeed, we hear a lot about superfoods, which are said to be able to prevent or lower the risk of cancer, whether it's blueberries or kale or goji berries or some certain kinds of mushrooms, etc., etc. There's so much hype on the internet that people don't know who to believe or what to believe. And in the end, they've already found themselves drinking a lot of herbal tonics or taking too much supplements to be cancer-proof. Do you even think cancer-proof is possible at all?
Gee whiz, I wish it were. You know, my dream is to discover the therapy, discover the food that's going to prevent cancer or eliminate it, so I put myself out of a job. That would be a wonderful outcome of all of this. The problem is we just don't know yet. So there haven't been a lot of studies that have looked at these superfoods and whether they can truly prevent cancer, because those studies would take years or even decades to complete. I think that people who tend to eat superfoods also tend to have healthier lifestyles and tend to eat other healthier foods and fewer foods that are bad for us. So I think if you incorporate those superfoods into an overall healthy lifestyle, absolutely you're going to reduce your risks of cancer. But to date, we have not discovered the one food or the one drug that's going to prevent all types of cancer. That just doesn't exist yet.
Well, if the superfood means healthy food, it's okay. But it means something else. For instance, some of the supplements might be too far from being healthy. That would not be all right.
Well, certainly I can just speak to the United States. In the United States, those types of supplements are not regulated by the U.S. Food and Drug Administration. Now, I trust in the U.S. Food and Drug Administration. I served on and was chair of the Oncologic Drugs Advisory Committee in the FDA for 5 years. I've seen how the process works on the inside, and I can tell you the FDA is very rigorous and very careful when it's vetting drugs for approval in the US. Supplements are not vetted by the FDA. That means that we don't know whether they work. We don't know all of their side effects. And some of these drugs can have significant side effects. We don't know about how they interact with other drugs that are given. So one of the most common interventions that I make when I'm seeing my own patients with cancer is to get a list of supplements they're taking and ask our leukemia pharmacist, since I specialize in leukemia, to review that list and review the chemotherapy or targeted therapy that we're recommending and make sure there isn't an interaction. And probably over half the time, there is an interaction that we have to adjust, that we have to ask a patient to stop taking a supplement so they won't have ill effects from them. The bottom line is supplements may be a good thing. There may be some supplements that really do work, but we don't know because they haven't been explored in formal trials and they haven't been vetted by a regulatory agency like the FDA.
Listen to the doctors will be a nice advice, right?
Yes.
Right, Professor, do you enjoy occasional drinking in your daily life?
So sure, I enjoy a beer. I enjoy a nice glass of wine, but it's a beer or a glass of wine,
Right.
and I drink far less than one per day. So maybe I'll have two beers in a week.
Right. You've mentioned smoking is certainly bad, and I think most people in the world knows that. But what about moderate drinking? Because you once said before that there is no alcoholic drink that is better than another. So what's your evaluation of drinking or having a little bit of alcohol and the cancer risk?
Yeah, it's a great question. The US Surgeon General last year actually formally listed alcohol as a cause of cancer. And there isn't any one cutoff where if you drink less than this, you won't get cancer, but if you drink more than this, you will get cancer. It's what we refer to as a dose-response relationship. So the more alcohol you drink, the higher your cancer risk. And I think with any lifestyle choice that we make, we have to weigh the benefits, the pleasure from that lifestyle choice and the risks of that lifestyle choice. For example, I ride my bike every week. I'm a bike rider. So I go out on the road and I ride my bike. There is risk in me riding my bike. I enjoy it and I get exercise from it. There's a health benefit, but there's also a health risk because I'm on the road and I could get hit by a car. When I drink alcohol and I limit myself to just two drinks, no more than two drinks per week, I am introducing a little bit of a risk of cancer, but not a great risk, and certainly not as much of a risk as somebody who drinks 4 or 5 alcoholic beverages per day. So it's an individual choice how much risk we're willing to assume for how much benefit or joy we're getting from an activity.
It becomes philosophy, life philosophy indeed.
It does. It does.
Right. And do you suggest a regular checkup? Health checkup?
Yeah, I do. So I go to my general internist, my primary care doctor, once per year for monitoring of things like cholesterol or blood pressure. For me, as a man who's over the age of 50, I have undergone cancer risk screening. I have undergone a colonoscopy. I have chosen to have my PSA checked, which measures your risk for prostate cancer.
Right.
And I encourage men to do that. I encourage women to undergo their regular cancer screening as well. I live in Florida in the United States. We're a very sunny state. So I also go to a dermatologist every year for a check for skin cancer.
Great. So how once a year, checkup once a year is able to screen cancer.
Correct.
Great.
Correct.
Nice to know. And many people are worrying about the genetic risk of cancer as well. Professor, in your opinion, is it worthwhile for someone to consider a regular genetic check?
I love that question. We will check the genetics of a person. In other words, there are two types of genetics that we talk about in cancer. There's the genetics of what went wrong with one of those rogue cancer cells. In other words, what changed in the cell to allow it to grow uncontrollably. That's an acquired genetic mutation, something we're not born with. And then there are genetics that we're born with, right? The reason I have brown hair and somebody else has blonde hair. For people who are worried that they may have inherited a cancer gene, we recommend assessing that first in people who develop cancer at a young age. They have a higher likelihood of having inherited a genetic tendency to develop cancer. Secondly, we recommend it in people who have a strong family history of cancer. If, for example, if I developed prostate cancer and my mother had breast cancer and her mother had breast cancer and my grandfather had prostate cancer, that would be a signal to me that I should undergo genetic testing to see if we have the BRCA gene that increases the likelihood of breast cancer and prostate cancer. So it is, again, a personal choice, but we go into genetic screening with assessing our own potential risk of developing cancer. And like I said, people who are younger who develop cancer and people who have a strong family history are those more likely to have inherited a genetic tendency to develop cancer.
Well, in terms of a genetic risk or mutation, high risk mutation, what are your suggestions in terms of lifestyle? Do you think a healthier, a better lifestyle can still work?
Yeah, so another great question. What if you discover that you do have a tendency to develop cancer? Well, number one, sometimes we recommend more frequent screening. So, for example, I don't have an increased genetic risk to develop colon cancer, so I would undergo a colonoscopy once every 10 years. Somebody who does have an increased genetic risk for developing colon cancer might undergo a colonoscopy every 2 years. Um, a woman who's in a family where many women develop breast cancer and she herself has a tendency to develop breast cancer might start to undergo screening with mammograms, not at age 40 or 50, but at age 30 or 35, much younger, to try to catch that cancer early. The second intervention goes back to what we talked about earlier, and that's lifestyle modifications. If you already have one genetic mutation that predisposes you to get cancer, we don't want you introducing other factors that can introduce additional mutations that lead to cancer development. And those factors, once again, are things like smoking, alcohol intake, and diet.
Right. And now for someone who has just been diagnosed, let's say, with cancer, it must be very overwhelming moment, overwhelming news to him or her. What is your advice to both the lifestyle and also the mental adjustment of a person who has been newly diagnosed?
Yeah, I'm someone who has a new cancer diagnosis. It's overwhelming. Um, I think the first piece of advice I would give is that cancer doesn't define a person. You're still the same person you were prior to your cancer diagnosis, and never forget that. I think secondly is I'm a firm believer that knowledge is power. So learn all you can about your cancer, about prognosis, about risks, and adjust your lifestyle accordingly. There are a lot of cancers that we consider chronic conditions. There are a lot of cancers that people die with, not from. So it really affect your overall survival, which is wonderful news. There are
Mm,
more and more cancers that are now curable.
mm,
We're seeing the rates of people who are alive 5 years after their cancer diagnosis more than double in the United States over the past few decades. So it isn't the death sentence that it once was.
mm,
And for people who do have cancer where they're going to undergo significant treatment, let's say they are going to receive chemotherapy or long-term immunotherapy or targeted therapy, um, build a support network. There are a lot of people in your life who want to help you,
mm,
and they just don't know how to ask. This is the time when you can actually ask for their help, ask that they come with you to appointments, that they help you take notes, that they help you remember what the doctor or nurse said. They're
mm.
waiting for an invitation, so don't feel as if it's an imposition on somebody else.
It's interesting, Professor, that you just mentioned that uh, a diagnosed patient will live better or not with knowing the cancer or not. Because in China, we do debate if we should tell the patient about the truth, about the diagnosis or not. Which is better?
Well, in my experience, I've been practicing for more than 20 years, and I've certainly encountered families where they've asked me and my team to not tell the person that he or she has cancer. I will tell you that 100% of the time they know. They already know.
Mm,
So the family works very hard to not use the word cancer in front of them and not tell them they have a cancer diagnosis, but the person always knows. And I've seen that time and time again when a family does decide that they're going to break the news to the person, and the person says, I've known this all along. This is not news to me. So I worry that when a family doesn't tell a person that they have cancer, the person doesn't trust the family.
mm,
And they're living in two truths. And for me, from my perspective, that introduces additional stress to the person with cancer.
mm.
That not only are they undergoing treatment for a cancer that they know they have, but then they have to worry about their family, who's in turn worrying about them.
Right.
So my advice is to tell the person that they have cancer. They already know, and it eliminates two truths that people are believing as they go through their therapy. It minimizes the stress that person has to undergo.
To tell or not to tell? That's the question. Well, summarizing everything we've discussed so far, Professor, would you please give us a comprehensive checklist for cancer prevention and care?
Sure. So we start with trying to prevent cancer. So modifying lifestyle behaviors that we can modify, including eliminating smoking, minimizing alcohol intake, and modifying our diet, minimizing the intake of red meats and processed meats as much as we can. We then move on to things like exercise and undergoing cancer screening. Cancer screening, cancer prevention are the absolute top interventions we've made to lower cancer rates in certain types of cancers. If someone does have a cancer diagnosis, remember, knowledge is power, and cancer doesn't change the sort of person that you are. We have made some incredible advances in cancer treatment, so people are living much longer with cancer over the past few decades than we've ever seen before. And knowledge is power. Learn about your cancer, learn about the prognosis, and understand what you're going through so you have an accurate impression of how serious your cancer is. Many times you'll learn that cancer isn't as bad as you thought it was.
Mm. Well, Professor, I know you've accompanied countless patients through their cancer journeys. You've witnessed a lot of struggle and resilience during the process. Would you please share one story with us that impressed you the most?
You know, I've met so many special people over the course of my career who have um, had a cancer diagnosis, and I've learned from them. I've learned how to live life in a way that I value what's important. Um, I think about um, one patient in particular I met who had a cancer diagnosis. It was an advanced cancer. He was admitted to the hospital because the cancer had come back. And we were about to start therapy when his wife stepped in and said, there's something he really wants to do that he needs to do outside of the hospital. Can we delay the chemotherapy at all, or can he take it as an outpatient? And I asked, well, what is that? And he spoke up and said, well, I have a young daughter who's 5 years old, and we were really hoping to go to a dance tonight. There was a daddy-daughter dance that he wanted to participate in. And as he told this story, I thought back to when my daughter was 5 and we would dance together at a wedding or at an event. And I remembered how she was so little, she would put her feet on top of my feet, right? And I would lift her up, and we would dance together as fathers and daughters often do. So it reminded me, and of course we said to him he could leave the hospital, he could go to the dance. We worked out a way that we could give therapy to him where he didn't have to be in the hospital. It reminded me what's important in life, and how we should always be focused on our friends and family. That's so much more important than our own diagnosis or the work that we go into every single day. It also was a great message to me about how important it is as a patient to remind your healthcare team what's important to you and how they can modify your treatment to accommodate what's important to you.
Thank you indeed for sharing that story of the power of love, of human care, and of hope, most importantly. Well, before we go, as we close this conversation, what would your words be to the people who are currently fighting cancer, or the families who are supporting one?
Yeah, remember, you're not alone. The cancer doesn't define who you are. Remember to ask questions. Never hesitate to ask questions of your healthcare team if there's anything that's confusing. And remember to communicate your goals to your healthcare team so they're choosing the right therapy for you at your stage of life.
Thank you. Thank you very much, Professor Sekeres, for your wisdom and inspiration. Really, really wonderful talking we had just now. Thank you.
Gee whiz. Well, thank you so much for having me on your show. It's a real privilege.
It's our pleasure. And well, everyone, the fight against cancer is not just in hospitals. It could be in your kitchen, it could be in your life habits, and it could be in your fridge at midnight. So be careful, watch out for your lifestyle. And take care, everyone. I'm Li Dongning. Thanks for watching. Bye for now.